So those are things that clearly should be followed up on. And whenever any of those urgent danger signals is evident, we should follow up with a careful risk analysis, a careful evaluation of potential for suicidality, and be sure not to leave the person alone until the risk level has been assessed by somebody who's competent to do that. In assessing an individual for suicidal potential and threat, it's very important to know the things not to do as well as the things to do. For one thing, as I've mentioned several times already, do not leave a potentially suicidal person alone, even for a few moments. If you have not yet ascertained that they're safe, make sure that somebody responsible who can prevent self-harm stays with them. Do not tell the person that they don't mean it. Even if you are fairly confident that they don't and that it's a threat rather than a promise, it's not a good strategy to de-emphasize the significance of their pain and their concern. Don't try to explain away the person's symptoms or their feelings. One of the worst things that one can do is to say, you don't really mean that. You don't really feel that way, do you? No, that's not the way that a person should feel in a situation like this, because what you're doing is invalidating their feelings, and you may very well communicate to them that you're invalidating them as a person, or that you simply don't understand. Don't promise to hold the suicide plan in confidence. That's really critical because, number one, you then will have to break that promise, or probably will. And number two, it's a bad, very difficult and problematic position to be put in yourself. When a person who has any of those risk factors or warning signs or urgent danger signs comes to you and says to you, I'd like for you to keep something in confidence. I want you to keep it private. It's confidential. Will you do that? Make sure that your response is not, of course I will, but rather your response is, that depends on what it is. There are certain things that I would have to tell somebody else, but I certainly would discuss it with you first. Don't use self-disclosure as a means to make the person feel better or to get them to promise not to commit suicide. It's generally not a good idea to say, yeah, I feel that way myself, or I have felt that way in the past, and here's what I did. Very often the individual will see that as either disingenuous or as attempting to minimize their feelings or as inappropriate self-aggrandizement or self-revelation. Don't be afraid to take control of the situation. When a person is not able to convince you or to assure you that they're going to be safe, and even if they become angry with you for taking action, make sure that you take the action that's necessary to keep them safe, even if they get upset with you. There have been a number of times in my career when I've had to have someone involuntarily committed because I felt that they were at significant risk to themselves. And at each of those times, well, most of them anyway, the individual got very angry with me for doing that against their will. And in each case, after a few days, when I would go to visit them in the hospital, they would invariably be okay with me or even thank me for saving their lives. It's important not to let the anger of the moment dissuade you from doing what needs to be done to keep the person safe. Don't allow the individual to imply to you and lead you to believe that you're the only person in the world who can help them, or that you are their clear salvation. The fact is that lots of people can help, and lots of people may very well be needed in order to help. So thinking that you're the only one who can do anything to save them and allowing them to lead you to that belief can end up being very burdensome to you and destructive to the overall goal of keeping them safe. Make sure, when a person is potentially suicidal, that you're part of the solution and not part of the problem. As Maxine says, ever notice how people who tell you to calm down are the ones who got you mad in the first place? And sometimes that's the case. Make sure that you don't pour fuel on the fire. Make sure that you don't engage in any of those not to-dos, and that you're part of the solution rather than part of the problem. Well, what would make you part of the solution? Some of these things you probably already know, perhaps some you don't yet. What to do? First, help to break the code of silence in any way that you can. It's so important that we communicate to everybody who potentially can be our eyes and ears with regard to who might be suicidal, that it's of critical importance to tell somebody who has the expertise to do something effective when a person has told you that they're at risk, that they're thinking about harming themselves. Strengthen and emphasize protective factors. Many of the protective factors that we've discussed already are things that can be improved, things that can be strengthened. And to the extent that we can do that, like helping the person to get involved in some self-esteem building activities, helping them to form better and more effective social support networks and so forth, can be lifesavers. Link them with school or job or community resources. Many employers, many insurance plans have an employee assistance plan. There are community mental health centers and options for low-cost intervention in the community. Make sure that you know about those options and that you know how to link individuals who may be at risk with those options. Ask about suicidal ideation, intent, and plans, and teach others to ask. As I've mentioned a couple of times before, you won't give those who are suicidal ideas, and you won't give those who are not suicidal ideas. Instead, you may very well save a life by asking. Take the person who's expressing suicidal feelings seriously. Do not denigrate their feelings, their emotional responses, their what you might consider emotional overreactivity. It's very important that you acknowledge and validate their feelings. Allow them to express those feelings. Many times you won't want to hear them. Many times you may be tempted to say, you don't really want to hurt yourself, do you? That's not the way to go about it. Instead, ask them, have you been feeling like hurting yourself? Tell me about that. So that you make it as matter of fact as possible and as open-ended as possible, and you encourage them to talk. Listen without judging. It's very important not to be judgmental, especially when somebody is contemplating suicide. To tell them that their feelings are wrong, to tell them that what they are thinking about doing would be wrong, and so forth, is not likely to be helpful. But instead, may very well interfere with your establishing and promoting a relationship or maintaining one that already exists. Contract with the person to remain safe in some way, and we'll talk more about contracting in just a moment. I realize that the literature on suicidal contracts or anti-suicide covenants is equivocal. I think the reason that it's equivocal is because even though those covenants or contracts have a place, they should not be the only step or the only element of a suicide prevention plan. And therein lies the problem with them in general. Help the person make specific, concrete safety plans. Make sure that both you and they and anyone else who's involved knows exactly what they're going to do to keep themselves safe and what others are going to do to help promote that safety. If urgent danger signs are present, stay with the individual until they're safe or until you can hand them off to somebody who's competent to take care of them. And unfortunately, my experience has been that in the case of minors or the elderly, relatives are not always competent to take care of them. There have been a number of cases a few cases, because I learned my lesson, in which I recommended to parents, in fact, I urged them to take their child or their adolescent to the emergency room because I believed they were suicidal. In several of those cases, they did not, placing the child at great risk. So make sure that the person to whom you hand off, the one who's potentially suicidal, is competent to take care of them and to ensure their safety, and get help when you need it. Many times, in fact, in virtually every case, when you're dealing with a person who's suicidal, you will need help even if you are a very competent professional. And follow through with the recommendations, the reasonable recommendations of other professionals. You need the help, you need to seek it, and it's important to take the professional advice when you receive it. There are a number of questions that ought to be asked in a comprehensive evaluation of risk and suicidality. Questions like, do you feel safe? Do you feel lonely, isolated, alienated from others? Do you have a support system? And if so, what's the extent of that support system? Tell me about it. Do you feel helpless, hopeless, worthless? And do you have reasons why? Do you have a suicide plan? How? When? Where? Do you have access to the means to carry out that plan? Do you believe the method to kill yourself will, in fact, result in your death? Have you had suicidal thoughts, plans, and or attempts previously? If so, how many and when? Is there a history of suicide among your family members or close friends or people that you really cared about? What is your view of death and what's likely to happen after death in your view? Do you currently enjoy the things that you usually or used to enjoy? For example, being with friends, having hobbies, eating, so forth. Have you recently experienced changes in your eating and sleeping patterns? Do you find your emotions difficult to handle, especially lately? Sadness, angry feelings, and so forth. Do you notice a decrease in your energy lately? And how long have you felt this way? Are you using drugs or alcohol to help make yourself feel better? And have you changed your pattern of use lately? Can you and will you contract not to hurt yourself for some specified period of time? And if so, what period of time can you make that promise unequivocally?